Illinois taxpayer subsidies for migrant health care could run over budgets by this fall. That's according to a hearing yesterday with the Joint Committee on Administrative Rules dealing with the taxpayer subsidies for migrant health care. That's part of the current state budget. Welcome back. Springfield's Morning News on 92.7 WMAY, Springfield's News and Talk. So just a quick civics lessons for Illinois. When state passes a law that the state agency is supposed to manage, the state agency then is given rulemaking authority, either emergency rulemaking authority, but definitely permanent rulemaking authority. And then they file those rules with the Joint Committee on Administrative Rules, which doesn't approve rules, but they can block rules. So they had a whole host of things yesterday that they were dealing with in JCAR. One was coming from the Illinois Department of Human Services, which is handling the subsidies for migrant health care. And back in 2020, the state of Illinois opened up subsidies for migrant health care for those over the age of 65 in the country undocumented. But then in 2022, they expanded that to have those in the country undocumented over the age of 42 to have health care, subsidized by the taxpayer. No federal tax dollars, only Illinois tax dollars. Then there were estimates on how much this was going to cost the taxpayers, and it was estimated to be way north of $1 billion for the current fiscal year. So Governor J.B. Pritzker, talking with legislators and crafting the budget, was able to secure rules to be able to manage the cost. So the budget now is only $550 million. But again, yesterday during the Joint Committee on Administrative Rules, the headline here is that you've got Illinois taxpayer subsidies for migrant care possibly going over budget this fall. So here is one of the agency directors, agency officials, talking with State Senator Christina Castro yesterday during the Joint Committee on Administrative Rules about the issue of migrant health care and how much it's going to cost, and if they're going to go over budget because of the continued costs and how much this is on taxpayers to cover. So here is that back and forth.
I think one of the things that obviously constituted the emergency rulemaking process was just the status of the legislation as passed by the General Assembly, which did provide emergency rulemaking authority in Senate Bill 1298. Then on top of that, we have projected liabilities of about $1.2 billion for the program if no changes are made. The resources that were made available to the department by the General Assembly through the budgetary process was $550 million. Spending, $120 million a month gets us to about November. And I think our concern is being able to protect those individuals already enrolled in the program to make sure that the changes that they see to the benefits that they've already enrolled for and have come to expect, that the disruption to those benefits can be minimized as much as possible in order to protect, their health and welfare. I think it was really just looking at our monthly expenditures within FY23 and knowing that we're continuing to see double-digit percentage growth in enrollment every month that led us to the conclusion that the sooner we're able to implement the changes, as I mentioned before, the less dramatic impact on those existing customers.
So again, Governor J.B. Pritzker, when the new budget year started July 1st, he changed the enrollment. So no longer is it 42 and up. Now it's only 65 and up. And he's putting co-pays in place. But even Democrats on the Joint Committee on Administrative Rules were critical of the Pritzker administration for not talking enough with JCAR or not talking enough with the advocates in this space, saying that it seems like the rug was pulled out from under them and they're not able to cover the costs. But when it comes to the overall costs, State Senator Don DeWitt, he said that he can't see this even possibly working out because of just the exorbitant costs to the Illinois taxpayer.
We're talking about potentially 2% of the state's $50 billion budget. That's a significant amount of money. And I would certainly make that as a recommendation that perhaps COGFA, a report that everybody in the system sees on a monthly basis, should have their eyes on. Regarding that $650 million budget constraint assignment that you've all been given, and again, I think Tom Cruise should be here because I see this as mission impossible, frankly.
So Don DeWitt, of course, talking about how it's just impossible to actually fund this. Here is State Representative Stephen Reich, who was very critical of how the governor has managed this, getting to the point where we are today.
This responsibility for this goes a lot higher than you folks. This is another instance of a governor that thinks he can run this state on his own. First, he did it with his 40-some disaster declarations. Now he's doing it with emergency rule. Not to mention the fact that the 24-month hiatus of issuing new emergency rules after the expiration of an emergency rule was voted on in the House as well. So basically, what we've done is we've turned this program into a one-man show.
So again, Stephen Reich highlighting how the governor's the one that holds the bag on this. He said it's not on the department, it goes higher than the department. It's the governor that's treating this like an emergency instead of having it actually go through a legitimate legislative process. So obviously a lot of costs and concerns there. We'll see that story again because they're going to come back in 30 days to actually deal with this issue some more. It is Springfield's Morning News. I'm Greg Bishop on